Good afternoon. I'd like to welcome everyone here to the Commission chambers today. I want to thank everybody in attendance, especially thank the mayor and Dr. Qureshi and everybody for being here today in Athens-Limestone Hospital. We have sat down and had a meeting this morning, and we have decided, if we can follow all the state guidelines and everything, that we will reopen county offices Monday, May the 11th. We've had a meeting with all departments heads, and if everything goes as planned, that's the way we will operate. We will be able to be a little different. We will operate strictly under the state health ordinance that we will not allow over 10 people at a time in, and that it will be different. And I know it's going to be trying and hard, but we will have extra security. We have installed glass between us and the employees, so we think that we can operate safely here with protect our employees plus place our citizens. We're not going to require you to wear a mask, but we strongly encourage it. If you come to any county building, to wear a mask, and for your protection and our employees' protection too. But our only thing that will not open is our senior center programs, because that is still under state ordinance, and we will not reopen senior centers, but all other county offices will open. And I want to give a shout out to the community, especially the Athens-Limestone Hospital. We have made it through this with low case numbers. We've done a great job, and I think it's the citizens and the hospital staff that has caused this. We have stayed on top of this thing well. I know that people are chomping at the bit to get out. Social distancing is still important. Good hygiene, washing your hands. Dr. Qureshi, put it out plain. This disease travels down, and the social distancing is vital. So that's when we reopen. It will be social distancing, and we will maintain that throughout all county buildings. With all that being said, I'd like to welcome the mayor of Athens, Mr. Ronnie Marks, to come up and say a few words and see what he has to say about the city. Thank y'all.
Thank you, Colin, and thank you all for being here today. I appreciate the opportunity to just come and update our citizens. I think it is vital that communications stay open during this critical time. I appreciate Athens-Limestone Hospital, Dr. Qureshi, and all the staff that keep us updated. I'm sure that citizens would much rather hear the medical updates than they had from some of us. But I want to tell you that the City of Athens is open. We're open for business for critical services. Our doors to the office is still closed. We look at it open on May the 15th or the 18th, I guess, would be that Monday. We're having the plexiglass up for safety also. I encourage people to wear their mask when they're out in public, to maintain social distancing and sanitize. But it's an opportunity for all of us. We have called off all of our spring sports activities with the City of Athens. We'll look at those as things progress for the fall. But I just want to tell you again how much I appreciate the citizens of this community in maintaining and leveling out this COVID-19 virus. So thanks. Oh, Doc, you got it.
Good afternoon. Thank you, Mayor. Thank you, County Commissioner. Appreciate your comments. And yes, kudos to the public for following the social distancing guidelines. We've kept Limestone County as a safe haven. We've been very successful, and we should be proud of that as citizens of the county. Athens-Limestone Hospital has done a wonderful job. All the 6 patients that got admitted have done well. I think except for one, everybody has been discharged. We have had no fatalities, and my hat's off to the ICU staff that took care of these patients, and to the hospitalist service, Dr. Hansard and his team that managed these patients at the hospital. So we should be proud of that, and proud of our community, and proud of our hospital. With that, I'll take any questions.
What are you expecting moving forward with this virus? Although it's slowing down here in Limestone County, we're seeing spikes in other counties across Alabama.
We were just talking, I was talking to the mayor just now, and there's going to be hotspots. Sometimes initially it is sort of surprising, what's going on here. and then you can pinpoint it to something, for example, a meat plant or a chicken plant. So we have to be watchful for those sort of things. Otherwise, pretty much everything has tracked the density of the population. So as you go from a densely populated area to a less dense area, as it stands to reason, social distancing makes the difference. And so with fewer people, the virus does not have a chance to spread as easily. So that's the key factor. But there's going to be hot spots, and we've got to be on the lookout for that. And your question about opening up again, I heard somebody say the other day, and that's a very good description, is when we stopped everything, it was like turning the light switch off. But now it's not going to be like turning the light switch on again. There's going to be a dial back sort of thing. We're going to get into it slowly. It's baby steps. And then we'll find out how we're doing, and it'll be a feedback sort of, and then we'll determine going forward. We'll listen to what's happening in other states and what their experience is, and of course what's happening in Europe, and go from there.
Doctor, elective surgeries, from my understanding, are going to be once again restarted starting today. Is that the case for the Athens-Limestone Hospital, and how important are elective surgeries? I know it's the basis for funding a hospital in general.
Yes, a lot of thought went into this process about opening up, and I think, if I'm not wrong, Monday the hospital is opening up for elective surgery. Of course, everything will start out again with a dial-back sort of notion. It'll be, not full swing right in the beginning. And having said that, I personally feel that it is appropriate and it is okay for people to reschedule their surgeries and get their problems taken care of. The hospital, to me, is a very safe place right now, and I think as physicians, as nurses, we look forward to our patients coming back and to renew our relationship with them, and to take care of business and get back to business as usual. So the hospital has a very carefully thought out plan about how they're going to ramp up again, and I feel very secure in telling the public that they can get back with their physicians, get back with their surgeons, and try to get their problems taken care of, medical problems taken care of.
As we transition to this safer at home order, like you said, it's not like turning the light switch on. Can you talk about the importance of people not rushing out to stores, not congregating, stuff like that, and what that safer at home order really means for people here in Limestone County?
Well, safer at home means that some of the restrictions have been lifted, but not all, and common sense still prevails. Starting May the 1st, the virus is not just all of a sudden from being suspended in the air, settle down on the earth, and then just stop spreading. That's not what's going to happen. So we have to use common sense. We don't need to be just getting into the truck and going out and go shopping or go to the restaurant. We have to follow the guidelines that the state has put in place, what the governor has put in place. They have some very thoughtful process. Dr. Scott Harris from the Public Health Department has done a good job on this, and I think they have been more cautious than other neighboring states. That's right, that's good, and we have to always think of the vulnerable population, the elderly, the people who have COPD, heart failure, kidney transplant patients, these people who are at risk. They need to be protected, and so we don't need to be, contributing to spreading the virus. We have to recognize the enemy, and we have to take due precautions.
When the elective surgeries reopen on Monday, are the restrictions in the hospital going to change at all? I know in Huntsville there were no visitors allowed whatsoever. Are we going to look at possibly allowing allowing more visitors to come in the waiting room? Is that going to be kind of reopened?
No, we're trying to practice as much social distancing as possible, so they have some guidelines. As I understand, it's suggested that not more than one visitor come with the patient, and even then, I think some of them, they'll be asked to sit in the car and wait, and then they'll be called to come in when the surgery is done. So there should not be, we don't expect congregation and people getting together in the waiting rooms. That's very important. I'm glad you brought that question up, but we are looking out for that.
There's other states in our country that are offering widespread testing to anyone who wants to be tested, regardless of if they have symptoms or not. Do you foresee that happening here in Alabama or in Limestone County?
I really can't answer that question, but we have right now at the hospital, we have good testing capacity. The turnaround time is good, and so we feel that given our county patient load right now, I think 40-some patients tested positive, the capacity for testing, I think, is adequate. But yes, I mean, if you're doing a surveillance, if you're in a surveillance mode, for example, New York State, they went out and tested patients at random, and they found out that their positive rate was about 14 or 17%, something like that. So of all people walking around in New York State, 14 to 17% were positive. Well, that's a big difference compared to Limestone County, for example, or the state of Alabama, where of the sick patients, the patients with symptoms who were tested, it was 14 to 17% that were positive. You see the difference? So our state has much less penetration of the virus, which is very good for us.
When the elective surgeries come back, I know a lot of the employees throughout the whole entire hospital system were furloughed because they obviously weren't necessarily needed at that point in time. Monday, when the elective surgeries return, could we see a return to a lot of those furloughed workers?
Yes, the furloughed workers necessarily will have to come back because operating rooms were almost shut down except for emergency surgeries. So all those people will come back. They'll have to, like I said, dial back and get going again. So routines have to be put back into place. And at the same time, the hospital is secluding some areas in case there's a surge. So they have made some preparations for to maintain surge capacity. But yes, this is going to be like a big locomotive starting again. It's going to take time. It's going to take a thought process, and people who come in and come back to the hospital, they should realize that.
Yeah, speaking of furloughed workers, there were a lot of older doctors and older employees who were also furloughed because they were considered more at risk. Are we going to see a return of them, or are a lot of those physicians still operating via telemedicine and those kind of?
Well, still, if necessary, if the patient prefers, telemedicine is a very good option, a very appropriate option. I have done telemedicine over the last few weeks. It's a new experience for me, and I can tell you that yes, it does give some support. It's a crutch, but it's still not the same as seeing a patient face to face. That's a big difference. If I can put my stethoscope on a patient's chest, I feel much more satisfied after having seen the patient than doing a telemedicine visit. And of course, a lot of our patients don't have the means to do telemedicine, so we just sometimes talk to them on the phone. So it's not an ideal telemedicine environment yet, but telemedicine is going to have its place in the next few weeks and months going forward. But as much as possible, I want people to use common sense. If somebody has a chronic illness, a medical problem, they need to understand that there's a risk posed to their health from that medical problem, their heart failure or their diabetes, versus the risk posed to themselves and to the community by their coming into the doctor's office. And I think now we're at the point I really think now we're at the point that if they have some ongoing medical issues, they need to come back to the doctor's office. They need to make appointments and come back in. And as long as precautions are taken, I think the patients should start coming back in, and that way we can go over their medicines, check their medicines, go over their lab work, and do things in a more normal fashion.
We're seeing a flattening of the curve here in, I would say, majority of the counties in Alabama. What happens when flu season comes after summer? Are you concerned that a second round of coronavirus could come through with the flu?
I hate to be a doomsday pronouncer, but yes, I am very apprehensive about that. When the flu season starts again, this is a probability, not a possibility. In my opinion, it's a probability. And notice one thing, that in the last few months, like compared to our previous history, the influenza cases have actually gone down. And even a child, if you talk to them, they'll give you the answer that it is because of the social distancing we have practiced. And so common sense will prevail, going forward in the flu season. The same precautions that we take for COVID-19 also apply to the influenza virus. And this double whammy could possibly hit us hard, influenza virus on the one hand and COVID on the other.
Anything else you want to add that we didn't ask?
Once again, I think, we're medical facilities and hospitals, doctors' offices, they're not bars. They're not, tattoo salons, and so, these are serious operations, and people should consider coming back and, resuming their medical care, which had been suspended on account of the appropriate fear of the virus.
I have one more thing for you. We're getting feedback from people that we talk to, thanking members in their community, people that they work with. What message of thanks do you have at this time?
All the frontline workers, every single one of them have done a marvelous job, and my hat off to them. They need to be commended. The hospital has done a marvelous job. The nurses have done a marvelous job. They have volunteered without having been asked, or told to do certain duties which were high risk as far as catching the virus. And so everybody that I know of has gone over and beyond their call of duty. All right, thank you. Mm-hmm. All right.